During an NABH assessment, assessors often ask hospitals one very important question. Do all patients in your hospital receive the same quality of care? Or is there any difference in treatment between private room patients, general ward patients, cash patients, insurance patients? According to NABH standards, the principle is very clear. Patient care must depend on clinical needs, not on the payment category. And this requirement is defined under NABH COP-1 standard. The COP-1 standard states, uniform care to patients is provided in all settings of the organization and is guided by written guidance. In simple terms, this means, hospitals must provide uniform, consistent, and standardized patient care. This uniformity must be maintained across all clinical areas including OPD, emergency, daycare services, inpatient wards, ICU. Objective elements of COP-1. COP-1 includes several important elements that hospitals must implement. These include written guidance for uniform patient care, standardized patient identification system, evidence-based clinical practice guidelines, clinical care pathways, multidisciplinary care planning, safe telemedicine services. During NABH assessment, assessors verify these through hospital policies, patient records, clinical documentation, staff interviews. Uniform patient care. The first requirement of COP-1 is uniform patient care. Hospitals must ensure that all patients receive the same quality of treatment, regardless of financial category, ward category, payment source. Treatment decisions should always depend on the patient's clinical condition. Let's understand this with a simple example. Suppose a patient is diagnosed with pneumonia. The patient may be admitted in general ward, private ward, ICU, but the treatment plan must follow clinical guidelines. It should never change based on the ward category. This is what NABH means by uniform patient care. Uniform patient identification. Another core requirement of COP-1 is a standardized patient identification system. Hospitals must use at least 2 patient identifiers. For example, patient name, unique hospital identification number, UHID. These identifiers must be used during investigations, blood transfusion, medication administration. This helps prevent serious patient safety errors. Patient identification methods. Hospitals may use different identification methods such as patient ID bands, patient labels, electronic medical record systems. However, the system must remain uniform across the hospital. Evidence-based clinical practice. COP-1 requires hospitals to implement evidence-based clinical practice guidelines. These guidelines may come from national professional bodies, international medical organizations, Government of India standard treatment guidelines. These guidelines help ensure standardized treatment, clinical care pathways. An excellence element of COP-1 is the implementation of clinical care pathways. A clinical pathway is a structured treatment plan that guides disease management, defines treatment stages, standardizes patient care. NABH recommends that hospitals develop at least 2 clinical care pathways every year and review them periodically. Multidisciplinary care. Some patients require treatment from multiple specialists. In such cases, hospitals must develop a multidisciplinary care plan. Examples include cancer patients, transplant patients, diabetes patients, palliative care patients. These treatment plans may involve doctors, nurses, dietitians, physiotherapists, psychologists. This approach ensures comprehensive patient care. Telemedicine services. COP-1 also includes provisions for telemedicine services. If a hospital provides telemedicine services, it must have written policies, standard operating procedures. Telemedicine services must follow ICMR Telemedicine Practice Guidelines 2020, Ministry of Health Guidelines. Hospitals must ensure patient identity protection, data confidentiality, secure data storage. If telemedicine services are outsourced, the hospital must maintain a formal MOU or agreement. Common NABH non-conformities in COP-1. During NABH assessments, common non-conformities include clinical guidelines not available, weak patient identification system, clinical care pathways not developed, multidisciplinary care not documented, telemedicine policy missing. Hospitals must address these gaps to avoid NABH observations. How hospitals can become COP-1 compliant. Hospitals can comply with COP-1 by implementing evidence-based clinical guidelines, developing a uniform patient identification system, creating clinical care pathways, implementing multidisciplinary care planning, developing telemedicine policies. These steps help hospitals effectively meet NABH COP-1 requirements. In the next video of this NABH training series, we will discuss COP-2. Emergency services are provided in accordance with written guidance and applicable laws. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.